we potentially are plateauing in perhaps May. But it really depends. We are in it for a long haul, at least for another month or two. This is not disappearing in the next 3 weeks. No matter how we wish to compare to Wuhan, this is not Wuhan. Certain ways, we can't divert 1/4 of all the doctors and nurses from other parts of the country to come to one epicenter like China did. So, again, we're in it for at least 2 months or more. And maybe the vaccine will arrive earlier than 12 months if we get really successful trials that gets to terminate early so we can give it out to everyone sooner.
Okay, so doctor, if we're talking global comparisons and you're saying don't look to Wuhan, I mean, there have been concerns with New York City looking more like South Korea in terms of the number of cases, but could it get to something as dire as Italy? Because we've all been just shocked by the deaths in Italy.
Yeah, I think U.S. should compare to Italy in certain ways. South Korea, the testing is still like over 50, almost 100-fold higher than the United States. Italy, in terms of comparison, is much closer to, because their testing is low, the healthcare system is over capacity. New York already says we need double the number of hospital beds. We need 25,000 more ventilators by yesterday. And these are the kind of worry that the U.S. has, and we don't have enough personal protective equipment like N95 masks, and that means the capacity for hospitals to deliver care will drop. So no matter how much you flatten the curve, if you keep dropping the hospital capacity, you're never going to flatten the curve enough if our doctors are not protected. And the U.S. healthcare system is much further behind than Europe, for example.
Which is why you need a lot of money backing when it comes to the healthcare system preparing itself for this problem. Doctor, my question to you is with regarding to what doctors can do, such as yourself, to look at the existing drugs and work with combinations to treat the disease right now. So President Trump tweeted on Saturday talking about how hydroxychloroquine, which is an anti-malarial drug, and azithromycin, which is antibacterial, if taken together, have a real chance to be one of the biggest game changers in the history of medicine. Of course, you went a bit overboard with that, but do you think that in combination, some of these drugs can work to actually cure the illness?
Yeah, anecdotally, there are some interesting case reports, but case reports cannot be used as proof that something works. The main problem is that we need randomized trials. And the randomized trials, we can skip phase 1 because they're existing drugs, but the phase 2 trials will still take a bit of time. And if you want to be truly sure it's safe and effective, you have to wait for the trials. But I can see certain doctors already prescribing it off-label for it. I can't fault them if they want to try, but at the same time, we also still have a shortage of these drugs for the existing patients who need it. So I would prefer to go with science and evidence rather than hope and prayer based on a few anecdotes right now.
Hi, I'm Emily Tan, and thanks for watching CNBC. You can check out more of our videos by clicking on the boxes on the screen, and don't forget to subscribe to the channel for more. Thanks for watching.